We are back with more What's Now, continuing to discuss prostate cancer because September, once again, is Prostate Cancer Awareness Month. And you may not know that there's a racial disparity among prostate cancer. Here's more.
Despite great strides in prostate cancer care over the past several years, racial disparities in care persist. Black and Hispanic men have a high burden of prostate cancer mortality. And joining us to discuss this and more is Dr. Brian K. McNeil, Associate Dean for Clinical Affairs, Vice Chair of the Department of Urology at SUNY Downstate Health Sciences University. Welcome to the show, Dr. McNeil.
It's a pleasure to be here with you, Christine. Hello, Salt Lake City.
What has research discovered about racial disparities among men with prostate cancer?
Well, it's confirmed that racial disparities do exist. For the average man, the risk of prostate cancer is 1 in 8. That risk goes up to 1 in 6 if you're African American, and perhaps even higher if you have a family history. And when we consider men, Hispanic men, about 20% of all new cancer diagnoses in Hispanic men are prostate cancer diagnoses.
Is there a racial disparity in the utilization of new therapies for advanced prostate cancer?
Unfortunately, there has been. With some therapies which were introduced maybe a decade ago, we noticed a rapid uptake in white men. However, the uptake of these treatment modalities was a bit slower in Black men.
And how has COVID-19 and particularly location where someone lives affected treatment options?
Well, COVID-19 has been with us for some time now, and my heart goes out to anyone who's lost someone to COVID-19. And for those suffering with COVID-19 now, I wish you a speedy recovery. COVID-19 has led us to shift resources from cancer care to the management of the coronavirus pandemic. And this has particularly hit communities of color in urban areas hard. Some research has shown us that prior to the pandemic, Black and white men had equal access to surgery. However, during the pandemic, Black men had decreased access to surgery for prostate cancer care compared to their counterparts from other ethnic groups.
When should men get screened for prostate cancer?
Men between the ages of 55 and 69 should have a conversation with their physician about prostate cancer screening. It's what we refer to as shared decision making. If you're a man from a high-risk group, you should have this conversation a bit earlier on. For instance, if you're African American, if you have a family history of prostate cancer, or if you have a family history of breast, ovarian, or pancreatic cancer.
And where can we find more information?
You can find more information about prostate cancer at the Urology Care Foundation website, urologyhealth.org.
Thank you so much, Dr. Brian K. McNeil. I appreciate you being here today, telling us more about prostate cancer, the disparities that exist, and what we can do. Thanks for your time.
You're welcome, Christine. Take care, Salt Lake City.